If I could describe CPEHN in one word, I would say strength.
Dynamic.
Collaborative.
Multi-flavored.
Maravilloso.
Necessary.
I would use the word beacon.
CPEHN is a multicultural health advocacy organization working to improve the health of communities of color in California. We represent the voice of communities of color in Sacramento. We're also a resource and provide data and policy analysis to our communities. And we convene our partners to develop a multicultural health agenda.
In 1992, arrangements were made to bring together a cross-cut of the diversity of California to talk about health reform.
We were fortunate that there were a number of us who had worked together on some other issues around health, that there was a consensus and leadership around the need to come together. Really, the idea was we were stronger together than we were apart.
And the 4 ethnic partner organizations, the Asian Pacific Island American Health Forum, Latino Coalition for Healthy California, California Rural Indian Health Board, and the California Black Health Network got together and we developed healthcare reform principles for communities of color.
What we had was a group of very mature, committed folks who understood that this was the path that we had to take to get health justice for all of our communities.
And from that, through some early work to try to convene the other ethnic organizations and talk about the need for such a group, from that eventually arose the concept of the California Pan-Ethnic Health Network, or CPEHN.
I think most notably in 2003 we sponsored a bill, SB 853, authored by Senator Martha Escudia, that required all private health plans and insurers to provide language services to their members.
You know, CPEHN was pushing, and I respected that. It was the patients who lacked a voice in Sacramento, and so supporting CPEHN's effort on that landmark legislation publicly in the legislature, in the governor's office, is something that we'll always be proud of.
I think CPEHN is very much recognized for their role in the sort of the cultural competency debate. They're the voice of cultural competency. I mean, everyone else, again, understands it, but CPEHN comes to it from a very unique aspect.
Arguably, there's been no single organization in our nation more responsible for leading the way in terms of cultural and linguistic competency and proficiency in terms of healthcare. And it was organizations like CPEHN that said, wait a minute, health is not just occurring in a doctor's office. It's about transportation, it's about education, it's about jobs, it's about community and economic development, it's all of these things.
Having Our Say Coalition was founded in 2007 when Governor Schwarzenegger proposed healthcare reform, and we realized that it was going to be really critical for communities of color to have a very strong voice at the policy table.
Having our say is the best thing that happened to us, I'll be honest. And I learned a lot, especially because in the beginning with the street level, we used to do the services because the people need now. And we didn't have really time to reflect and really be advocating for our community that we serve.
Being a part of the coalition really helps us to get together and do rallies, do legislative visits, and to make decisions in a timely fashion.
For me, having our say is more than really passing bill, is creating this network, a really strong network, multicultural, multilinguistic, and you don't feel like you're alone fighting back home.
Well, congratulations to everybody who has been involved in CPEHN from our founding members, who I have had such a pleasure and privilege to have had the opportunity to work with over so many years, and certainly to the staff of CPEHN.
It's been a fantastic 20 years working with some really great people from diverse communities all over California. Thanks for inviting me to the party 20 years ago.
My message is to stay engaged, hold on tight, the best is yet to come.
So to the CPEHN family, I would say congratulations and keep up the great work.
I would say first, thank you for all your hard work. You know, advocacy is hard, and it's easy to lose heart. At heart, you need to be an optimist, and you need to keep working at it, because in the end, look what you got. I mean, you have language access, and that is huge. And so, congratulations.
In the end, it's the relationships between the people that make an organization work or not, and I think those relationships are really been a wonderful part of my life for sure.
Congratulations on 20 years worth of success and advocacy for the minority communities and underserved communities in California, and congratulations on the leadership that CPEHN has provided for our communities, not just in California, but throughout the country.
Para mí es muchas felicidades, que cumplan muchos años más y que este network sea cada vez más grande. Es, más que nada eso, felicidades. Continúen con el excelente trabajo que hacen por la enseñanza y la confianza. Porque eso más que nada confianza, because I feel like they believe and they trust you and they give you opportunities to be part of the change.
Thank you, CPEHN, for the leadership you provided this state and underserved communities throughout the years. You've had a great first 20 years. We look forward to an even more terrific next 20 years. CPEHN, congratulations. We love you.
I think CPEHN has come a long way in the 20 years since we've been founded, and we still have a long way to go as the state and the country keeps getting more and more diverse. I hope that we will be able to continue partnering with other advocates, our community leaders, and policymakers to really create a state that promotes health for everyone.